94.3.
It's 6:16.
Time check is brought to you by Daiso Japan. Most products from 7 Qatari Riyals. Now open at City Center, Doha, first floor.
Keep listening. Keep listening. Stay where you are. Live. Online. On air. And on ground. Kabayan Radio 94.3.
Health is wealth. Ask about your health conditions because the doctor is in. The doctor is in right here on Kabayan Radio 94.3.
A wonderful evening mga kabayan. You are tuned in to the first and the only Filipino radio station here in Qatar, Kabayan Radio 94.3. Welcome to Candid with Candy. Of course, we'll be with you from this hour all the way until 9. But on the first hour of the program, we will be having our The Doctor is In segment. My name is Kenzo.
And of course, this is Ate Girl RJ Andi, and welcome to The Doctor is In episode. It's a good Tuesday evening. And of course, sasamahan tayo ngayon sa isa sa ating mga expert from the Gulf Dental Center.
Right.
And actually partner with 16 years of experience. And she has been working in Qatar for 13 years already with professional certificate in cosmetic dentistry, and with high diploma degree in pedodontics, and of course with laser services privilege from QCHP. Let me just introduce to you Dr. Raghdaa Al-Tohami of the Gulf Dental Center, our GP dentist for tonight.
Hi.
Good evening, Doc.
Good evening. How are you?
Thank you for joining us here
Yes.
at Kabayan Radio. And tonight, we are going to talk about creating beautiful smiles.
Yes. And of course, partner, we've always been wondering as to what are the secrets of this Hollywood celebrities, right? Kung bakit nga ba super ganda.
Yes.
Uh-huh.
They are-
So maybe on my first question, Doctor, what do we mean by having beautiful smile?
Having a beautiful smile is having a smile that makes the patient or the patient is more confident about himself or herself, with the color, with the shape of the teeth match the facial features of the patient. He should be having like really a self confidence and happy and willing to smile all of the time.
Right. So
This
that's
is the
having
clue.
like that feeling of creating that smile
Exactly.
coming from within.
Exactly. As
And
if
it's not
he's-
just about the aesthetics, but actually that particular feeling of being
Exactly.
confident.
Exactly.
So how do we become really confident when we smile?
To become confident, the first thing the people should know is how to make the smile looks natural. The problem now that all the patients are seeking some features that make the smile looks artificial. And this is what we are trying to change in the patient's concepts. Like they are seeking for a severe, very bright, white,
Very white.
artificial
Yes,
color.
I do
And
notice that a lot with
yes.
celebrities as well, but I
Exactly.
do recommend, let's go for natural looking.
Exactly. This is what we are trying to fix.
So since
No.
we've been mentioning about the natural looking way, do we have steps or recommendation for a particular patient?
Of course, there's a lot of steps. According to the patient's condition, the teeth condition, the gum health, all this interfere in our treatment plan. If the patient have good teeth, aligned teeth, healthy gums, and only just needs a brighter smile, a brighter
Right.
color that seek natural shape, then we can go for bleaching only.
Right.
If he has nice teeth, we don't have to cover it up.
Right.
But if he has more issues in his teeth, like deep discolorations, like some chipped teeth, some teeth are shorter than the other teeth, some malalignments, like little alignments, we can fix this with our porcelain veneers.
Okay, so we're already talking about the procedures.
Yeah.
Exactly.
And when we were discussing earlier
Just
about
jumped in.
creating, I
Yeah.
mean, it's okay. I mean, what I was just like thinking earlier is that when we are creating smiles, natural smiles, as you were mentioning, it's something that we can achieve.
Of
And
course.
this is through a procedure that many call Hollywood smile.
Exactly.
So how do we really define having that Hollywood smile? Does it really mean that it has to be perfectly aligned teeth? Does it have to be perfectly white?
The Hollywood smile is for the dentist. It's like a commercial name for the porcelain veneers.
Okay.
For achieving this smile, as I said before, it's according to the patient condition. If the patient already has aligned teeth, the features of having a Hollywood smile, the teeth should be aligned. They should be in a certain proportions according to the facial features of the patient.
Okay.
According to the width of the mouth, the thickness of the lips, the space that's created when the patient is talking or opening his mouth. All these proportions should be adjusted. When achieving all these proportions plus the veneers, then you will have a Hollywood smile.
Okay.
Some patients, some lucky people have all these things
Right.
without veneers, and they are so lucky.
How I wish I'm one of them.
Yes, actually, yeah, honestly, you are. You have a very nice smile.
I don't think so.
This is the issue now, because patients having a lot like very high, not high, it's not unreal expectations.
Yes.
By seeing other people having chalky white teeth,
Right.
big teeth, like we want this. No, this will not look nice on you. This is what we have to tell our patients. That's why we have to tell the patient how the smile will look like
Okay.
before even starting.
So that's the next question that I'm going to go into. How do we know what is the best kind of treatment that a person should have? I mean, when I go to your clinic and I say that I wanted to have that Hollywood smile, what is the first step that you're going to do? And would there be some x-rays?
Of course, we will start with the x-ray, the panoramic x-ray, because we have to be sure that he has good gums, good healthy bones, healthy teeth. There should be no decay or any dental treatments that should be done before the procedure.
Okay.
Second, we will start to discuss with the patient what exactly he doesn't like about the smile. Let's say what you exactly don't like. We have to hear the patient very well. We have to listen to him very well, because maybe what he doesn't like is something simple. That he will not need a big change. Sometimes we do a lot of nice procedure, then the patient tell, but I only wanted to change this one.
Right.
But we have to listen to the patient first, and then to discuss to the patient the look of the smile before even starting. There is a lot of ways, like digital designs. We can take photographs of the patient, a profile and the front photos, and show the patient the look of the smile before even starting.
Oh wow.
Yes, before even
So
starting.
there's already like a
preview.
image,
Exactly.
an image of
an
you
image and a preview.
after the
Exactly.
procedure.
Exactly.
Okay.
Before even starting. Then the patient can add, I want this to a little bit taller. Then if it's appropriate for his facial features, we will tell, okay, we can make it a little bit taller, but you are having a limitation for this and for this according to your face, according to your lips. So it will look at the end natural smile. We want it nice and natural. We don't want it artificial.
You're making me think about going to your clinic. Like
You're welcome.
Kenzo
maybe
is
after
now
this
considering
program.
it, Doc.
Okay, we're welcome. We can go now.
But I do have a question, partner. Okay. Now, if let's just have a little bit of an example, like a situation. I am a beauty contest, contest pageant
Wow.
goer. Okay.
Wow.
Wow.
Let's just say it's an example. Okay.
Oh my God.
Let's say if I really want a bright teeth, I want a aligned teeth, I want the Hollywood smile, but when you have the assessment on me, I mean, I really don't need it in the first place. So how do you say it to your clients or patients? How do you suggest? Or if they're going to insist, you're just going to do it?
According what they are insisting about.
Okay.
If it's only about a color of the teeth, this
Okay.
can be fixed by whitening.
All right.
Or home bleaching kits. If they insist about shape, a certain shape, they want to change the shape of the teeth for a certain way, then we have to do that veneer. We have to listen to the patient. But please come before your event. Don't come at the night of the event. Because don't come and tell me before. Tomorrow I'm having my event.
Okay.
We need some time. So we need some
Especially
time.
if you're joining a contest.
Yeah, you have to be
Exactly.
prepared for like a year. I mean,
You have to come like at least 6
It's
months
part
before.
of the process. Yeah.
At least you can see your preview. You can see what you need. You can at least you have time to change your mind
Okay.
about some changes. But don't come at the same night, please.
Right, definitely. Well, we were actually talking about having that veneers.
Yes.
Is that applicable to everyone who does not have an aligned teeth, or do some people people required to undergo other procedures such as, dental braces or orthodontic braces before they can actually even consider having veneers?
Yes, it's according, like if the condition need braces first, I prefer we go for the ortho first, because ortho is about changing fixing the problem without touching the teeth, without covering them, without maybe the patient after having the ortho, we will change his mind about the veneer.
Okay.
And for me, preparing the tooth, I have to prepare the tooth. Preparing the line tooth is more simple, and it will save a lot of tooth structure than preparing a malposed or malaligned tooth.
Right.
So, because we are now going for conservative treatments in dentistry, we're not going for destructive treatments, only conservative. So it's better to fix everything first. So when I prepare the teeth, it will be only just very simple preparation, a very simple space for the veneer itself to be placed on the teeth.
Okay, that's good to know that everything is like being prepared before.
Yes, it should be prepared, clean, no inflammation in the gums. I'm really focusing on the gums, because the gums really, if they are inflamed, it will take
these are
a lot
quite
of
sensitive,
time.
Doc, right? When it comes to
it
the
will
gums.
cause this bleeding, sensitivity. If the patient will skip the gum treatment and have sensitivity, he will think that the procedure of the veneer is the reason, but actually no, the gum.
It was actually the gums.
The gum health, and treating the gums takes too much time. That's why come before your event.
I'll come before my event
come.
on June 23, 2020 for the Philippine Independence Day.
Okay, come.
See you there, guys. Okay.
Are you joining the pageant?
No. I just want to be pretty on that day.
She booked an appointment, I think.
Maybe tomorrow she'll be there in your clinic.
She booked an appointment. Nice.
So I heard this. There's another type of like a crown or jacket that you put on your tooth apart from the veneers. I've heard about Emax. What's the difference between veneers and Emax?
Actually, Emax is the material we use to do veneers, and it's the most beautiful, natural, give us translucency and natural color. It's for veneers.
So it's more of like a brand for.
It's a porcelain type,
okay.
And it's for veneers, specifically for veneers.
So how many types are there for
there's a lot.
Veneers? You have the.
Actually, for now, currently the popular one is the Emax veneers, because the others are like, it's like history.
Oh, okay.
Like before, long time ago, they used to do zircon veneers, but they don't look aesthetic nice.
Right.
There is feldspathic veneers. They are nice but weak.
Look like plasticky.
Feldspathic is nice but weak. Emax is having a nice shape and durability, and it's not weak.
Okay.
So
and how long does this last? Since you're talking about the strength of this material.
For the maintenance is very important. Patients follow-ups. Brushing, taking care of the teeth, flossing twice a day, and brushing every day, at least twice a day. Visiting the dentist 6 months for cleaning. It can last for long. Some patients come with 10 years veneers.
Oh wow!
Of course, they don't come for changing them. They want to change them to something new, because the 10 years veneers doesn't look that natural, but they are durable. They can stay for a long time. But it has a big role for the patient. The patient should take care of his veneers. He not putting them and just.
Right. Just forget about it. Thinking that it's just all natural.
I have to go without cleaning, because as I said, if anything like caries, gums, because actually the veneer is covering only the outer surface of the teeth.
Right.
But the rest of the teeth still there. At the back, it's natural teeth, the gums. So we have to take care of this.
Does it affect the sensitivity of the tooth?
No.
Okay.
No, not at all. Not at all. The preparation is so minute, and actually it's covered already, so there is no sensitivity at all.
All right, that's good to know.
I just want to break in the conversation because someone from our Facebook page is actually asking about it's according to Di Ako Si Pepe, that's his name on Facebook. He wants to transfer to your clinic because of a very unfortunate service that he had with his current clinic. So he was asking if are there particular requirements or are there particular documents that he needs to bring with him if he's going to visit Your clinic?
The normal document to open a file, the ID, these things. But other than that, we will do the rest. We'll take his medical history, we'll do the X-rays, and we'll do everything else. If he has his old dental records, he can bring.
Okay.
As long as
That's
he had a old treatment or something. If he has a record like an old X-rays before that treatment, he can bring just to. But we will do the other needed X-rays and papers.
All right. Thank you
He
so
doesn't
much,
need
Doc.
to.
All right, that's good. Do you have other questions? That's it.
I think on the part 2, we're going to accommodate
Okay.
more questions
All
for
right.
that. Okay.
All right. Anyway, I would just like to know, who is the best candidate for veneers? Is it for everyone, or are there people who cannot receive that kind of treatment?
Yeah, there are some people who cannot get veneers. Unfortunately, people with active bruxism, grinding, patients with like inflammation in the periodontal ligaments. Teeth are moving already. Some mobility in
Okay.
the teeth. They need to go for treatment of these conditions first, especially this bruxism condition, deep bites condition.
Okay.
They cannot just go for veneers. They have to treat the condition first.
Okay. So most likely they'll be having some orthodontic braces
Exactly.
first before.
And other
getting
patients
that
with I don't know, for the lifestyle, some people have a heavy eater lifestyle,
Oh,
They
okay.
eat
All
like,
right. So I'll just cancel my appointment on June 23.
it's not the amount
Just
of
joking.
food, but
The
the
type of food that
type.
they eat.
Okay. Yeah, of course.
a lot of like hard food
Right.
around, a lot of nuts going around, a lot of seeds going around that actually the natural teeth can break from these things. The natural, not the veneers. Imagine if you are having nice veneers.
Right.
People who are chewing ice. I had one patient. This is a real story,
I'm
and
actually
she
that
wanted.
type of person,
oh my
maybe.
god! And she wanted veneers, but the problem that she said honestly that she likes to break ice with her teeth.
Mhm.
Oh.
So I just stop that habit and come.
I did that before going here.
Oh my god!
He did open a can of
Yeah, these people like
with his teeth. Yeah.
these candidates, they will break their veneer, of course.
Okay, so they're not allowed.
If they will fix this habit, it's all about their habits. If they can fix that habit, actually it's an unhealthy habit. Even if he's
Of
not going to
course.
have a veneer, he have his natural nice teeth, and then suddenly he broke it with a bottle, or he just broke an ice. This will be like a drama in his life. He will get angry, sad. So by breaking this habit, he can have anything he wants,
Okay.
veneers, or he can keep his natural teeth.
Right.
Yes.
Also,
So those are the things that need to be considered
Exactly.
before going for
Exactly.
veneers. How about age limit? Is there like an age limit for this? Because
good
what we
question.
were
Yes,
discussing
really.
earlier is more on the condition of the teeth. But how
Yes.
about the age of the person? Does that matter?
yeah, the age matters, but actually 20 plus. We don't
Okay.
give veneers for younger patients or adolescents or like the
Teenagers.
these teenagers. I don't prefer doing veneers for them for a lot of reasons, because the nerve inside the tooth is very big. It can get
Okay.
pain, and also they are still growing. They are still going through something called active eruption. The gums are still not in the right position. It's still moving till 20 plus. At
Okay.
that time, we can go for veneer. But
I see.
because I've seen a lot of young patients also.
Yeah, because a lot of teenagers
they are coming like
aspiring for that Hollywood
Yeah,
smile,
they
especially
see
they
the-
see it on social media.
Yes, they see
The
it on social
Instagram
media.
and the Facebook page.
Yeah,
era.
exactly. They just
It's-
come. I
it's
want
going
like
on in their
that.
minds.
You'll.
Yeah, I
You're,
want that.
you're still 13, 14. We cannot do
Yeah.
that. 15.
like at the time 13, 14,
exactly.
we
Still,
just play around
your
still. We
teeth
don't,
are super new. Yeah.
we don't think about veneers at that time, right? I'm not sure with you.
No, I wasn't.
No, of course not.
I was still chewing ice during that time.
I was just playing Chinese garter at the time, like 13, 14, but
Exactly.
not with veneers.
Now they're seeking, the beauty limits now is reaching its top, and especially with young age, they are like obsessed
Right.
about Instagram and
Right.
so. But at
TikTok.
least we should tell them they should like go to someone
Wait.
who will just tell them wait,
Right.
not to just grab and come. No,
Right.
just wait. Yani, when you are 20 plus and you have issues and you have problems, yeah, we can go for that.
All right, that's good to know.
Yeah.
How about any other procedure for that Hollywood smile? Because we're discussing mostly on the veneer aspect. Is there any other procedure that can actually help you achieve that smile without having to go through veneers?
Oh, yes.
Yes.
And apart from orthodontic braces, is there any other, procedure?
Yes, you can do some bonding, like some adding some fillings, not full covering with fillings, no, but some on the tips of the teeth to make
Right.
it aligned. You can do whitening. If you have like gums, like gummy smile, you can go for gingivectomy. Gingivectomy now
Okay.
is becoming very easy by laser. You can do all this, and you will have nice teeth, nice smile without going for veneers.
As
long
what
as,
is that procedure again that you were mentioning about the gums?
It's some people have gummy smile. When they smile, the
Right.
gums showing is little more
Right.
than the.
Right.
Then we can trim these gum margins with laser,
Okay.
dental laser, diode laser, not the
Right,
not the
right,
dermal
right,
laser,
right.
diode laser, and make it like we reshape it to looks natural again.
Okay.
So
Is this also the same treatment that you do for people who have small teeth, so that at least it
exactly,
would also?
exactly,
I'm actually
exactly.
considering having that.
Exactly.
Why?
But
have
you don't
small-
have.
I mean, these are normal.
You don't have gummy smile. Actually, your
I
gums
have
are nice.
small
Only
teeth.
lower, but upper
Okay.
is good.
Nagpaka-consult.
You can come tomorrow.
I'm having consultations right now here in the studio.
Can we come tomorrow, Doc? Like, can we end this live and just come tomorrow?
I'm actually thinking of bringing that light over here and then just
Check
opening my
now.
mouth.
Let's show them how we
Can we have a
check up
live consultation, please? Anyway, you mentioned about the gum procedure, right?
Yes.
Is it going to be painful?
No, it's not painful at all.
Oh,
It's done with topical anesthesia, actually. Sometimes we can do it even without injections. With
Oh,
only
wow.
the topical gel. Like, some patients don't feel anything. Like,
And how long is the recovery time for that?
one day, next day, you will be fine.
Oh, okay.
I'm
You
able
can
to
go
talk
back.
in the radio
Of course.
after that.
On the radio and on TV and
Okay,
everywhere.
perfect.
Everywhere.
And you can go back to your normal eating habits.
Yes, only
Okay.
one day you will have some instructions not to go for spicy food, not to smoke, like that.
Okay.
Well,
Okay.
like normal instructions after any dental procedures, and then you can just
All right.
have your ice back. You can
Alright.
eat your ice.
We'll have to think about it, Doc, because I cannot live a day without the spicy food.
Oh,
Just one day?
this is challenging.
Just one day I cannot.
This is challenging now. This is a big challenge.
Anyway, Doc, so since we've been discussing about the gum procedures, now I'd like to ask, can cosmetic dentistry fix receding gums?
Yes, in some cases, some slight recession, we can use crowns, you call it jacket, with something we call it porcelain color. It's like a pink porcelain that imitate and match the gums color. But if the recession is more progressive, then it's better to go for perio treatments,
Oh,
not to fix this with crowns. But according to the case, if it's simple case, only one or two teeth, yes, we can fix
Okay.
that. Yes, yes, it can be fixed.
Alright.
All right. That's good to know. Do we have any other questions, partner, from our viewers?
Well, we actually have shout outs from our viewers because one of our viewers are actually your patient.
Oh my God.
We have JR Ting. We have Jovi.
Okay.
So they're actually viewing us on our Facebook Live right now. So
Okay.
can you say hi to them, Doc?
Hi. How are you?
All right. So also I'd like to ask, since I've already asked about the receding gums,
Yes.
can cosmetic dentistry also fix overbite or underbite?
I prefer overbite and underbite be fixed by ortho. It will be much more better than using crowns in this condition. Because if it's really aggressive, it can break the crown. So if the overbite is a real overbite, like a progressive one, it will not be for crowns will not the right thing to fix with this. Go for ortho. I know the issue with patients, good you asked this question, because the issue with patients in this condition that overbite and underbites take a lot of time with the ortho treatments.
Yes.
This is what this is the issue. That's why they want
Right.
something quickly. Even
Right.
when you tell them it will not really match that much, you can have, they will don't, it's okay, and break, I will come again.
They don't listen. And they want to
Yes,
insist, right?
okay, just do the crowns. If it big, I will come again. But actually, we want to have long-term treatments.
Right.
Because if every time your crown break, who did this crown to you? Oh, find another one. It's not. You have a. It's not a
Right.
good repetition for you
Right.
as a dentist. You know.
Of course.
Right.
So you have. This is what I want our listeners to hear, that overbite and underbites really, it's a hard condition.
Mm-hmm.
But please fix it with ortho first.
Right.
When you
right.
fix it with ortho, you will have a permanent, nice bite.
Mhm.
Permanent, nice. Maybe you will feel confident, and you will not do the
Right.
veneers,
Right.
and you will not do the crowns.
It's a good thing that you highlighted
Yes.
that, because
Yes.
there are a lot of people who would want to have
As we-
like an instant solution
yes.
to their
Yes, exactly.
dental concerns, and they want to
Exactly.
have veneers immediately.
Yeah, exactly.
But yeah, it was really
Tomorrow
good that you
the event.
highlighted.
For the
She'll come to work fixing. Exactly. This is what I wanted to
Most of the
highlight.
people actually would think about having an instant solution of their
Exactly.
problem.
This is the problem.
So if you're thinking about engaging on it, I mean, you have to think of a lot of times.
If you if you decide to fix it, and we give you the advice, just we have to do it in the right sequence.
Right.
Don't go for like commercial shout outs like, come for us, we'll do it fast, we'll do it quickly.
Okay.
This is not something that you feel confident for. Don't go for that.
Right.
Let's quickly come. We will not only 2 visits, only 1 visit, only half a
Yes,
visit,
yes,
only 30
yes.
minutes. Only you have to
Okay.
feel suspicious about that.
Okay.
Because fixing this will take time.
Mm-hmm.
But it will give good results at the end.
Right, right.
Like,
So to everyone who's listening to us right now or
Yes.
watching us live on Facebook, all you have to do is go and visit Gulf Dental Center
Yes.
for you to have an assessment of your teeth. And they will be providing you some recommendations on the treatment plans that they will
Yes.
be providing you. And of course, you will be guided by experienced professionals.
Yes.
Is there any other thing that you would want to add about, achieving that beautiful smile?
I want to add that the patient has a big role in his smile. Even if we did our best and the patient didn't help us,
Right.
we will not get that result.
Right.
Help us by taking care of the oral hygiene, taking care of the teeth, brushing, coming in the appointments, not skipping,
Right.
not going to the schedule, coming on appointments, coming for the follow-ups. He has a big role. The patient has a big role in helping the doctor to get to the
Right.
result that he
Right.
dream of.
Yeah, it's not only the doctor's role
No.
about to create a perfect
This is a
smile for you.
collaboration.
Yes,
When you
it's
want
like
a
a-
Hollywood smile or a
yes.
perfect smile, then you have to collaborate.
Nearly,
with your
instead
doctor.
of telling me I hate the dentist, I'm afraid of the dentist, just you have to be like the family member of that dentist.
Right,
Yes,
You
right.
have to keep
yes.
coming
Right.
because we are happy to see all the patients in our clinic. We are happy to see but they are not happy. The first thing they say, I'm afraid of the dentist.
Right. And
I'm
at the end of
scared.
and at the end of the day, it's not just about creating a beautiful smile, but it also affects your health, right?
Health and shape and everything.
Yeah,
And
because
I think it's your
Yes.
lifestyle as well. That should be
Exactly,
changed if something
exactly.
needs to be changed.
Exactly, like
right?
diet, like weight, like everything, like anything, like these things.
Diet just surprised me about it. I'll have to think about it like a million times.
me too.
No, there's actually someone who's asking from one of our viewers. So coming from Tom Louise, how about the cost for veneers? Can you just give us approximation?
Actually, the cost is decided after the consultation, and actually the consultation is free.
Okay.
Because
That's
we
great.
have a lot of patients asking how much for the they are afraid of coming because of the price of the consultation,
Right.
but the consultation is free. Really, it's free. There is no hidden fees anywhere. It's
Okay.
free, and the panorama is free, so there is no hidden. There is no tricks. I know
Right,
that
right,
they are
right.
all traumatized about some tricks from other places, but there is no tricks. The consultation is free, and the panorama is free. And he will get all the answers he needs. He will get a very nice quotation according to his condition. If the teeth need filling first, if the teeth need
Right.
scaling first.
Right.
All this have makes the prices variable. Like
Yeah.
there's a variability in the prices, but he will get a good quotation.
Right.
And he will know all the details before starting. He will not get shocked by something in the
Yeah.
middle, like
Oh, yes.
there's an extra fees for something.
Yeah, it's
All these
hard to put a price point at the moment because
No.
it has to be like an individual assessment. Each and every
Exactly.
case is different.
Exactly.
So
Exactly.
yeah, it would be best if you go and
Exactly.
visit them in their clinics for you to have an assessment of your
Exactly.
teeth.
Exactly.
And let me just add, coming from my sister's experience, because she's one of the patients as well of Galt Dental Center, the aftercare treatment
Yes.
was amazing.
Yes, yes, this is true. All the patients are accepted anytime. They can come anytime. Even if they have something they need to fix, we can just fix it
Right.
without just extra fees. It's
Right.
like a bond between us and the patients. Really, it's
Right.
like a long-term bond. You just
Right.
don't just come and fix and just tell us what's the problem. What
Okay.
you can also, the accessibility to the dentist is easy.
Right.
All the patients have our numbers. Like there's
Right.
contact numbers. They can come anytime. They can come walk in.
Mhm.
So I think this is good. This is really good.
And sometimes, depending on the type of treatment that you're going to have, there may also be some payment plans. It's not going to be like a one-time payment. There could be some payment plans.
Exactly. It's
depending on the treatment,
yes, yes. It's actually it's for the dental treatments. Every step has a price, but the treatment takes several steps. So it's very hard to take all the
Right,
price,
right.
the fees at the one
cost,
time.
yeah, yeah.
We give the chance for the patient. Some patients tell I can start now. I tell yeah, we can start by the end of this month. You
Right.
can pay part. Then by the
Yeah.
new month you can start the rest of the treatment. You can pay the other part.
Exactly.
So there is a collaboration and just we are just really caring for our patient. We know that
That's nice.
we know what's the problem, that there is some problems in payment like that. They don't have to worry about this really.
Okay.
We give good quotations.
Right.
A lot of patients got some quotations from me. They look around, then they came back.
Yeah.
Yeah,
Actually, the price point for
Yes.
the treatments at Gulf Dental Center
Yes.
is very, very competitive. I mean, I've also been,
You
a
went to-
client
Yeah.
of Gulf Dental for a long time. And then I went somewhere else, but came back.
Okay.
I came back.
Yeah, we have a lot of.
But that's the
patients
best
there.
thing.
I came back. What
Best
have you been?
decision.
I just I came back.
Well, I just tried,
yeah.
something else. But, one of the best dental
Yeah, thank
centers
you.
here in Qatar. But if there will be some listeners and viewers right now who would want to visit you, how they can visit you and where can they visit you?
In Gulf Airport branch.
Airport branch.
I'm there 9 a.m. till 12:30 and 5 p.m. till 9 p.m. Only Thursday is 9 till 5.
Okay.
And they can have my phone number. Actually, I have a Facebook page. I have
Okay.
an Insta. There is an appointment system. They can take appointment through that system or through the landline of the
Okay.
old airport branch, or they can get appointment through WhatsApp. My number. I can say my number. Or,
Yeah, sure. Definitely.
314-789-43. This is my WhatsApp number.
Okay.
They can contact anytime.
How about your social media handle? What's your Facebook or
It's my name,
Instagram?
Dr. Raghdaa Al-Tohami. And for the Insta is DR and 2 underscores Raghdaa RAGHDAA because
Okay.
I couldn't find Raghdaa with 1 score.
Okay.
Unfortunately, I put 2 underscores so I can get a username. It's good I got the name actually.
Partner, I'd like to say hi first to Lida Teres. She was actually asking about the cost for veneers per teeth. So I think Dr. Raghdaa over here already had answered. It actually depends on...
It depends on the condition of that tooth.
Yes,
Even maybe
okay.
there is a filling, maybe she has decay. Who knows? So
All right.
And by the way, right now, just in case you're wondering what is the phone number of Gulf Dental Center, actually, Gulf Dental Center staff are watching right now. And they are also putting in the information on the comment section of this live feed. So you can go and check out the phone numbers there in the comment section.
Thank you so much to all of the Gulf Dental Center staff for supporting, of course, your doctor over here
you.
and for giving us the details that our customers, prospect customers, and our listeners and viewers are actually asking. So, also, I'd like to say hi to Syed Mansoor. I'm not sure if this is his question, but he was actually asking about the treatment, bone treatment. I'm not sure if it's...
maybe he needs an implant usually or periodontal surgery. These are the conditions that patient can have a bone graft.
Okay.
Maybe he got like consultation somewhere. But for these cases actually he need to come and he need to do an
Okay.
X-ray to see the bone condition and define
Okay.
the price.
Okay,
Yes.
we have another question here coming from Saif, and she says that she has an iron deficiency syndrome, and she's taking iron supplements regularly, and she was informed by her dentist
It will make
that
discoloration.
there could be discoloration.
Discoloration, yes.
So, and which is happening right now. She says, even though she's doing like dental cleaning and even bleaching, will you recommend having veneers for her? And will this affect, the teeth?
It will not affect the teeth.
Yeah.
Actually, the iron supplements cause extrinsic stains.
Right.
It will keep happening till she stop the treatment, until she get well and stop the treatment. But if the stains are extensive according to the iron dose, if it's like higher doses, so if she's like doesn't want to do bleaching anymore, because bleaching has limitation also.
Right.
You can do it once per year. Or once
Right.
every 6 months. If she did also the home bleach kits, if they didn't have any effect on her, yeah, she can do. If she has aligned teeth and everything is fine, she can do the veneers, no
Right.
problem. She
Right.
will
And
have a
once she
permanent color.
Yeah, and once she has the veneers, she wouldn't be bothered by the discoloration because
stains.
it's already covered.
Yeah, exactly.
by the
She
veneers.
can cover the teeth, no problem. But she will come, of course, for cleaning and
Yeah.
the inside of the
Actually, I
natural
think
teeth.
that's a better option for you.
Yes,
right?
yeah.
That's a better option for you.
Yes,
Instead of,
yes, yes,
having
yes.
regular bleaching,
Yes,
veneers
yes.
would
It will
do
be
the
fine
trick.
for her. It will look like, yeah.
Oh, there's another question. I mean, this is a non-stop question. So
Sure,
are you
sure.
okay with it, doctor? Okay. So coming from Tom, what if the veneers installed is not really nice? Is there any cost for changing it?
Actually, before installing the veneers, this is a very important question. It is a very nice question. Actually, there is a step called try-in step. The try-in step is I will place the veneers on the patient's teeth with a temporary glue or temporary cement, and he will see how they look like. If he has any other comments like about the shape,
Right.
we can change that.
Okay.
We'll just take them back to the lab and change them to what he wants.
Okay.
And even in the preview, he was satisfied, but during the try-in, he's not satisfied. This can be changed.
Okay. So
This
during the
can be
trial
changed.
period, how long does the patient wear it? Is it only in the clinic, or would he be going home, spending
There
another
is two
day?
steps.
Mhm.
First step, we do in the lab a temporary template that he will wear in between the visits.
Okay.
This temporary template looks like the final veneers. Why? So he can get used to this the shape
Right.
of this teeth.
Right.
Because it's normal. If you change your teeth, the shape, you'll get surprised. Like, oh, this is
Yeah.
this is me.
Yeah.
What is this like? Like any cosmetic treatment. To make the patient his eyes getting used to the new shape, he has to put this temporary. We put for him this temporary in
Okay.
between the visits.
All right.
And when he's getting until he gets his veneers from the lab, this is the try-in. We remove the temporary and we put the try-in stage.
Okay.
This is inside the clinic.
Okay.
He will not leave with the try-in stage.
Okay.
It's
Okay.
inside the
Okay.
clinic.
Okay. So it's just for like a few minutes or an
Yeah,
hour or
like
two.
he can
something like
have
that.
his time.
Okay.
We just put them there. Enjoy. You can take your time.
So you cannot bring it with you.
You cannot take that.
Well, you
Just want to make sure, doc.
what one actually do
Some
as well.
some patients bring their friends. Like I
Right.
will bring mom. I bring my
Okay.
friend. I bring my
I
wife.
was actually just thinking about one of the things that
I
you
mean,
can
the whole
also do
family.
is take a photo, send it to your family or your friends,
Exactly.
get some
Yeah.
We
feedback
take
about,
photos with the try-in. We take photos with the try-in. We take photos before. We take photos with the temporary. We
Right.
take photos. We take a lot of photos actually.
Okay.
Some patients still, we don't want to all these photos. Why are you taking about this? Is my privacy. I'm shy.
Yes,
No,
yes,
it's okay. It's only for us. If you want to put it on social media, okay. If you don't want,
Right,
okay.
right,
It's like right. So in the try-in stage, if there is any changing in anything, we can do that. Even during the final, before final cementation, we put it there and we make the patient look. Bring his family. Bring your friends with you, because after leaving and asking your friends there, this will put you in a very
Yeah, I do have another question though.
situation.
How for the payment plans? Do insurance companies cover veneers?
Unfortunately, no.
Okay, but for the other treatments,
Insurance. Actually, insurance cover all the basic treatments.
okay,
That like root canals, fillings, cleaning, composite filling, pasta, as you say, pasta.
right. For Filipinos, yeah, we call it pasta.
Dentures. But
Mm-hmm.
for veneers, no. I hope they
Okay.
cover veneers because
Okay.
sometimes veneers is also a treatment.
Right.
Other than it's being cosmetic, it's really a treatment now.
And sometimes it also depends on the insurance company because even for
I believe,
orthodontic braces,
Sometimes-
some insurance
they
companies do cover
part,
it.
some other-
Some
yes.
cover partially
Part, yeah,
or in
exactly.
full. So it really depends
Yes.
on the insurance company. But
Yes.
which insurance companies are accepted? I mean, insurance card are
Mostly
accepted at
all of
Gulf
them.
Dental?
QLM, Alcoot, AXA, Allianz. I think we have GlobeMed also and NextCare. We have TIB. Most of them, all of them, I think. And actually, when the patient come, we send for the approval first.
Right.
There is no bad
Right.
surprises for the patient.
Right,
We will
right.
not start and then tell the patient, we're sorry, it's not covered. We will not do
Exactly.
that.
Because
We just take the approval first.
yeah, for every procedure, what the dental clinic does is that
Yeah.
they first get an approval from the insurance
Yes.
provider before doing
Before
the
starting
treatment.
anything, because some patients need to pay a copayment like
Right.
that. So he
Right.
need to know everything before we start. So he's free. He can choose. He will do it or no.
By the way, I would just like to say that one of our viewers,
Yeah.
Okay.
Syed Mansour, said that he already got an appointment and he's excited to go and visit Gulf Dental Center. So,
Thank you. Waiting
yeah.
for you.
We haven't been been talking about the appointments, but we already have appointment with you
Of course.
for tonight, Doc.
Of course.
Anyway, thank you so much for joining us here at The Doctor Is In. Just before we end the program, can you please provide again your social media accounts, your contact information, and invite everyone to go and visit you at Gulf Dental
Sure.
Center?
My Instagram is Dr. DR. 2 underscores Raghda, RAGHDAA. This is the Instagram. For the page, Facebook page is Dr. also Dr. Raghdaa Al-Tohami, RAGHDAA Al-Tohami, ALTOHAMI. For the contact, it's you can contact me on WhatsApp 314-789-43.
All right. And also, your colleagues at Gulf Dental Center have provided contact
And also the
information on the
landline.
comment, on the
Exactly.
comment section of this
Exactly.
video feed that we have on Facebook. So, is there anything else that you would want to say to all the listeners, to our viewers, or people that you would want to say hi to?
Give them a shout out, Doc.
I just want to tell them stop being afraid from the dentist, please.
Okay.
Don't be afraid. Khalas. No need to be afraid anymore. We are helping you. We are giving the best to take care of your teeth, take care of your health, and giving you dental advices. Even I have dental advices on my Insta page. Even if you don't want to come for an advice, you will find it on Insta. You'll find it on TikTok. Also, I have a TikTok as well.
Okay.
But after all this, still people are afraid of the dentist.
Right,
I don't know
right.
what we should do. I even have a rabbit filter. I don't know what to do else.
I think one of the things that people can actually do is to start early, especially if you have kids, right? So you can
Exactly.
bring them regularly so that
Exactly.
when they grow up later on,
Exactly.
they won't be scared.
Exactly. Mostly the kids are scared because of the parents.
Right,
The parents
right.
make them scared, or because the parents are so scared, so they just transfer this fear to the kids by mistake.
That's right.
But bring the kids early. It will be much easier for taking care of their teeth. It will be much better.
All right. Thank you once again for joining us here
Thank
at
you.
Kabayan Radio.
Thank you.
Thank you so much, Doc.
Really, thank you for you. Thank you.
And of course, if you would want to visit and have an appointment with Dr. Raghdaa Al-Tohami, all you have to do is go and have an appointment with Gulf Dental Center. And of course, with Gulf Dental Center, they create beautiful smiles for you and your family.
That's right.
Yes.
And of course, mga kabayan, thank you so much for being with us for this beautiful discussion with Dr. Raghdaa. But of course, our program still is ongoing with the Candid with Candy. So after this, the Doctor is an episode.
We will be on air all the way until 9. So keep your frequencies locked in only here on Kabayan Radio. We'll be back shortly. Once again, thank you very much, Dr.
Thank you so
Raghdaa.
much,
And
Thank
on
you.
behalf of
Raghdaa.
Kabayan Radio, we would like to thank Gulf Dental Center for making this episode of The Doctor Is In possible.
Thank you.
Thank you so much,
It was
Dr. Raghdaa.
nice, really.
Thank you. Bye, everyone.
Bye. No?
I us about your health conditions because the doctor is in. The doctor is in right here on Kabayan Radio 94.3.
Good evening. It's 7 o'clock.
This time check is brought to you by Gulf Dental Center, where beautiful smiles are created for you and your family. Gulf Dental Center, Airport Road, now offers a comprehensive rate for filling the interior from the starting rate of 100 Qatari Riyals and filling the posterior for starting rate of 150 Qatari Riyals with normal extraction for starting rate of 150 Qatari Riyals, scaling and polishing for 250 Qatari Riyals, and root canal interior for 500 Qatari Riyals. Visit Gulf Dental Center, Airport Road or call 7795-6366. You're in good hands with Dr. Alisa Cabarubias. For any information, please call 4411-3556 or visit Family Medical Polyclinic or Care in Al Azizia branch.
The current time is 7:01.
You're listening to the